I'm Karen Adams. Welcome to Look Local. This is the place where we feature the best and the brightest of where we live, as well as the distinct charm and character of Jacksonville. We do that by reminding you if you're looking for something to do or for someone to help, it is always better to look local. Our guests today feature CNS Healthcare. We're speaking specifically about mood disorders. Granite Transformations, we're going to show you how they can remodel your kitchen or bath by retrofitting it. And 904thin.com, a Nutrimost program designed to get you healthy and lose weight at the same time. I'm joined by Susan Angel, who is with CNS Healthcare, and today we are speaking specifically about mood disorders. Welcome.
Thanks. Thanks for having me.
Mood disorders are one of those things that a lot of people don't like to talk about because there's a stigma that surrounds them, unfortunately, but getting it out in the open and I think just raising awareness really can help a lot of people.
It does, and you know, it's important because mood disorders as a whole, there's a couple of ones that we'll talk about today, specifically people who have depression and then also people who have bipolar disorder. And, you know, millions of Americans, you know, suffer from each of these conditions, and it's important for them to be able to get care in a way that's helpful and allows them to enjoy a good quality of life.
Right. When we talk about depression and the difference between that and, like you said, bipolar, what is the difference?
You know, major depressive disorder is characterized by periods of depression only that, you know, last a specific time frame where people tend to see a disruption in their sleep, appetite, their activities may be impacted, just kind of an overwhelming feeling of sadness or irritability. And it lasts for at least a couple weeks in duration. And it may be recurrent or it may be a single occurrence. Also with the bipolar disorder, the old time description was, of course, manic depression. So when you think about bipolar disorder, you may think of a more cyclical pattern of mood disturbance.
Is it where they have highs and lows?
They can, absolutely. And then there's varying degrees in between. But, you know, to meet that criteria, there is that, you know, difference between the periods of lows, oftentimes followed by extreme highs. And then there's, you know, varying degrees of illness that fall somewhere in between.
Okay.
Yeah.
And, you know, it's normal for everybody to sometimes get depressed.
Absolutely.
If you lose a loved one or a pet, or maybe you have an illness or something happens to a child or something. Those are the kind of things that come just in life in general, just living life. So we go through those peaks and valleys as it is. But when do we know that we need help? What's the real troubling sign that you see that you say, hey, maybe you need to come in and get some medication?
Right, and you know, all those things you mentioned certainly can cause feelings of sadness and, you know, just feelings of uncertainty. But when we start to get concerned is when those things are prolonged, you know, during a time frame where you expect, you know, an individual may bounce back. But if it continues to progress, the point that maybe you're calling into work or you're spending too much time in bed or things that you used to enjoy. And that's one thing people tell me frequently is like, well, oh, I haven't done any of those things. I used to go to the movies. I used to enjoy going to the beach. I used to enjoy socializing with friends. But no, I haven't done any of those things lately. And so then you start putting this picture together. And when you get the full picture, you know, it's one of those things like, well, you know, maybe you need to go speak to someone and get some help. Either a therapist or sometimes medication is needed.
Okay. And so you guys have medication then, I guess, on a trial basis where you can come and go to CNS Healthcare and be treated and get the proper medications. And oftentimes, this is people that don't even want to tell their own doctors because they're embarrassed. And especially men have a problem with this, I think, too. They don't
like to talk about it as much.
No, it's a sign of weakness to well, at least they fear that it is a sign of weakness when it's not at all. But they can come to you and get this medication as well. Tell us how that works.
Well, what's really great about the services we provide is, yes, it is participation in a clinical trial. However, the assessments that we conduct to make sure that you're diagnosed accurately are very thorough and very state-of-the-art. And we're using various scales to determine the severity of depression. We're looking at your cognitive functions because, again, like attention and concentration are impacted with people who have depression. So we use different measures to make an assessment. And what's really awesome about the clinical trial is you've got access to the latest, cutting-edge treatments that are available that really, are may have less side effects than what's currently on the market, or may have a more rapid response. So something that may take 4 to 6 to 8 weeks to fully affect change, you may see something as soon as 2 weeks. So there's a lot of great opportunities available. There's some medications that you may only have to take once a week versus every day. So there's opportunities available, and this is something that you can do without having any insurance, without having a current psychiatrist. Just come on into the clinic and you can meet with one of our clinical staff to review your health status and, to see if this is something that could be helpful to you.
And that's what we're seeing now. This is what happens at CNS. You come in and they evaluate your...
Yeah, we've got 2 board-certified psychiatrists on staff specializing in both adult, child, adolescent psychiatry. We also have a clinical psychologist on staff, as well as nurse practitioner, registered nurses, licensed mental health counselors, who all are part of the treatment team here at our office.
Okay, let's talk a little bit more about the depression and the anxiety that oftentimes goes with it. And you've talked about medications that, SSRIs and so forth, that are the antidepressants. What if somebody has anxiety? Can they take those anxiety medications like, I don't know, the benzodiazepines? So we're talking Ativan, lorazepam, Xanax, and all of that. Can they be taken in conjunction with those SSRIs when people have that anxiety depression combo?
Ideally, when you think about medications for depression and anxiety, a lot of our current medications that are available can treat both of those things. When you think about benzodiazepines, the way I approach it is that it is a short-term solution, because each of those things, while beneficial, can have some long-term effects and risk for abuse. But yes, they can be taken together. And for patients who come to our office who are already on medications, we would evaluate your entire prescription list to make sure that it's something that's suitable for you.
What is the duration someone should be on those benzodiazepines? Because I know you've come on before, and I know we're almost out of time, but I think like no more than 3 months, they say, and if it's going to be more than 3 months, then to get on an SSRI, because you become not so much psychologically addicted, but more physiologically addicted, so it takes more to do the same than it would be when you first started, is what you said.
Right, and ideally there are certain situations where a benzodiazepine is a perfect solution, but for long-term use you need to look at the whole picture and see if there's a better treatment plan.
All right, excellent. Listen, thanks again.
Great, thank you.
We'll be right back in just a moment. Stay with us.